From News Channel 8, this is News Talk with Bruce DuPoit.
Thanks for staying with us here on News Channel 8. We turn our attention now to a medical condition that threatens something very precious, your eyesight. A growing number of Americans getting diagnosed with something called macular degeneration. This week, eye doctors are raising awareness about the affliction and what you can do, both in terms of diagnosis and potential treatment. With us now, Dr. Chun. He's with the Retina Group of Washington. Welcome. It is good to have you with us.
Thank you. I'm pleased to be here.
Tell us what macular degeneration is.
Macular degeneration is a disease that is caused by the gradual breakdown of the part of the eye that's responsible for central vision. It can cause blurred vision and distortion of vision. Left untreated, it can cause permanent blindness in the center of vision and interfere with activities such as reading, driving, or even recognizing faces. It's an important health issue because it's the leading cause of blindness in Americans older than 65. An estimated 10 to 15 million Americans are affected by macular degeneration, and 1.5 million of those have the advanced type, which can cause severe vision loss. That figure is expected to double by the year 2020, so it's an important health issue.
Are these holes, what's happening within the eye that leads to the degeneration in macular degeneration?
There are two types of macular degeneration. In the dry type, materials build up underneath the macula. These are called drusen. They appear as yellowish deposits. This can cause gradual blurring of vision over time. In the wet type, which only accounts for about 10% of cases of macular degeneration, there can be the growth of abnormal blood vessels under the retina, and this can lead to sudden loss of vision or distorted vision from leakage of blood or fluid underneath the retina.
Can anything be done? Let's say there's a diagnosis, patient comes, confirm the diagnosis. Are there treatments? Is there anything you can do to, if not reverse damage that's already occurred, at least maybe kind of hold things, prevent them from getting worse?
Right. As recently as 10 years ago, there were a few treatments for macular degeneration, and none of them worked particularly well. But over the past several years, we've had some amazing advances in the treatment of macular degeneration. And these medications can be very effective in reducing the impact of macular degeneration on your vision. At the Retina Group of Washington, we treat our patients with dry macular degeneration with Focus Macular Pro eye vitamins, which contain high levels of antioxidants that were proven by a large clinical study sponsored by the National Institutes of Health to help prevent the worsening of certain forms of macular degeneration. For patients who have wet macular degeneration, we treat them with these eye vitamins and medications that are delivered directly into the eye. These medications include Avastin, Lucentis, and a drug called Eylea, which was recently approved by the FDA. All of these medications work by blocking the growth of abnormal blood vessels underneath the retina. In large clinical trials and in trials conducted at the Retina Group of Washington, we found that most patients treated with these medications either have stabilization of vision or, in many cases, improvement of vision. For patients who already have advanced vision loss from macular degeneration, we encourage them to undergo assessments for low vision services and visual aids, including the Implantable miniature telescope, which is a new lens that was designed to take the place of a patient's cataract to magnify images onto healthier parts of the retina.
Wow.
And in patients who received this device at the Retina Group of Washington, we found that many of them had a significant improvement in vision.
Let me open the phone lines because I know there are people out there with questions or potential concerns about the condition we're discussing here today with Dr. Chun. So if you're watching live in the 10 o'clock hour, bring your calls right now with your questions. He can't obviously diagnose, but we can talk in general terms. 703-387-1020. That, as you know, is our number, and I'll do my best to get to your call as quickly as is possible. Grab an open line now, though. That'll help me get to your call. It sounds as though early diagnosis is more important now than ever for the reasons you just mentioned. Should people get regular eye exams even if they have no symptoms just to be on the safe side, or are most cases found because someone has an issue and they go to their doctor?
That's a very good question. Now, the most common symptoms of macular degeneration are blurring of vision or distortion of vision, where straight lines may begin to appear wavy. But many cases of macular degeneration start with no symptoms at all. So we recommend that all patients over the age of 50 undergo an eye exam at least once a year, and to undergo early treatment if some problems are found.
What causes this?
Well, it's thought that macular degeneration is due to both genetic and environmental factors. So macular degeneration is more likely to affect Caucasians than Asians and Africans. And it also is increased in families. So if you have a family member affected by macular degeneration, it's more likely that you can contract this disease as well. Lifestyle choices can also have a huge impact on the development and progression of macular degeneration. Smoking, for example, can more than double the risk of macular degeneration. High blood pressure and high cholesterol can also contribute to this risk.
Why smoking?
Smoking causes problems with the microvasculature underneath the retina. It can cause damage and it can cause constriction of these blood vessels, and it's thought at least part of the reason for macular degeneration may be due to poor oxygenation of the retina.
I know people who may be showing the early signs of macular degeneration. The doctor will send them home with a grid. It looks kind of like a checkerboard, a chessboard, what have you. It's horizontal and vertical lines on a page, and I guess they tell you to kind of tape it to the wall somewhere, and then what, do a daily sort of this?
Exactly.
How does that work?
So that is actually called the Amsler Grid, and you described it exactly. It's basically a grid with a target in the center. And it's one way that patients with macular degeneration can monitor their vision at home in between their visits to their eye doctor. So if they notice a change in their vision, it might herald the onset of wet macular degeneration, which requires treatment. For patients at Retina Group of Washington who have dry macular degeneration, they're given the opportunity to participate in a clinical trial with the 4C home device, which is a home monitoring system that may detect early changes in vision as a result of wet macular degeneration. And that may lead to early treatment and prevention of further vision loss and permanent damage to the eye.
Talk about Macular Degeneration Awareness Week. I mean, this is an exciting time for the reason you mentioned a moment ago. We didn't have that many options, treatment possibilities before. Now we're starting to see some. So what's the message of the week, of this period right now?
Right. So this week kicks off a 2-year campaign by an organization called AMD Alliance International, which is a global coalition of eye care professionals and patients. And the goal is to raise awareness of macular degeneration through education, through early detection and prevention of macular degeneration. The theme for 2012 is the prevention of macular degeneration.
Dr. Chun is with the Retina Group of Washington, here with some important information that I hope people take to heart. Thanks very much for your time. Good to see you.
Thank you very much.
We'll take a break. We'll come back with more right after this.